Good morning, good afternoon, good evening from wherever you're watching, and welcome to another episode of Something About Surgery. I'm sure you've heard of words like teaching and referral hospital, level 4, level 5 facility. What does it mean? That is what I'm going to discuss in this episode. The service delivery in the Ministry of Health is structured across 6 levels, level 1 through level 6. Level 1 to level 5 are facilities under the county government, if they are public, or coordinated and managed at the county government level, irrespective of whether they are public or private. Then level 6 are national facilities that only serve referral services. Now let me start with the level 1. The level 1 care is actually not a facility, it's a unit. It's a unit of community health volunteers or community health workers. They are involved with a lot of preventive and promotive services. You will see them in the villages gathering data, giving a lot of health messages, and trying to track any disease, outbreak, progress, etc. Community health volunteers is the level 1. You cannot walk into a facility and see it's written XYZ level 1 facility. It doesn't exist as a physical structure. But all those units feed into the existing facilities, which is quickly the next level, and that is a level 2 facility. A level 2 facility is a dispensary. And most of us have been to dispensaries to get an injection, to get a vaccination, to get some wound dressing, etc. And you know it's not large by infrastructure. It does not have inpatient services, and even the staffing is probably a nurse and clinical officer, and a few other cadres, of course. From level 2, the dispensary, we go to level 3, which is a health center. And then level 4, which is the former district hospital, or now the sub-county hospital. The level 5 is the county hospital or the regional referral hospital. And then level 6 is the national referral hospital. For instance, in Meru County Referral Hospital is a level 5. In a few days, it might be turning to a level 6. And then you're talking about Kenyatta National Hospital and the other national hospitals as a level 6 tertiary referral facility. What determines who is a level 1, who is a level 2, who is a level 3, who is a level 4? It is not by accident, it is by design. Certain levels can only offer certain services, can only be equipped up to a certain number of specialists, and can only get up to a certain amount of infrastructure because their deliverables are different at different levels. For instance, if you go to a level 4 facility or a sub-county hospital, now we are expecting to get a gynecologist, a consultant surgeon, and of course the medical officers, and a few aspects of imaging or X-ray services. When you go to a level 5 facility, which is now a regional facility, then you need to get all this pool of specialists who are able to feed off all these level 2, level 3 facilities and level 4 facilities and tackle increasingly complex cases that require more specialists. And then, of course, there are subspecialists and more dedicated specific investigations and infrastructure that are needed at the national referral level where a lot of teaching is taking place. Now, level 5, going downwards, are managed at the county level, like we said, and if there are private or faith-based facilities in that particular county, as long as they are level 5 downwards by way of what their mandate is and how their license after inspection reads, they will be coordinated at that level. The national referral level remains under the national government, and it remains as a referral from all these regional referring hospitals. Now, everyone would want to have a level 6. Why not have it? Why not have it in every town in your county? I mean, it is good to have all these specialists. But no, it is not by default, like I said. It's actually by design, because having some specialists there is not going to be feasible. For instance, if the entire of Meru County refers maybe 10 to 20 complex cases to Kenyatta National Hospital, why have a Kenyatta National Hospital here when the real need is just 20 patients. So sometimes with the political environment that's on, you might hear a lot of people saying, we are going to have a referral hospital in this town, but the question is there need? And if there is need, does that existing facility then need to be upgraded to that level, or can those services be taken care of at the regional referral levels? So that is the arrangement, and when you go down and your services have been taken care of, you don't have to feel like you need to go to a level 5, because what you needed has been addressed at that level, and the arrangement is such that if that care has not been delivered there, then you should be referred to the regional referral hospital. And if the regional referral hospital is not able to handle all your issues, then it is those issues that need to be cascaded up to the tertiary referral facilities. And most of the times people will want to go to the big hospital. I want to go to Kenyatta. I can't wait here. I want to go to Moi Teaching and Referral Hospital. But if we were to follow the policies that are laid down, those facilities actually should not receive walk-ins. And the facilities at the peripheral, that is the county referral hospitals, should not refer upwards if they can manage those cases. So that way, then we have the most desiring people getting to the referral levels, and those that have other issues that can be addressed being taken care of. Having said that, we have a list of excellent faith-based and private facilities as well that offer these services and are at the level of either regional referral, that is level 5, or at national level. And that kind of gives leeway for people who do not want to follow the public path to kind of still walk into a level 5 private, into a level 6 private facility and say, I came because I don't want to go to all those. So that is just kind of supplementing, but really the arrangement should be in the hierarchy that I've described. What about teaching and referral? Now, whether you are a regional referral facility, you offer teaching services because there are always medical schools there and medical colleges and other allied health colleges. So those regional hospitals become the teaching hubs. That is why everywhere you go, if there's a level 5, you will see it written teaching and referral hospital, whether it is a public or a private facility, because it is an expectation that is a lot of teaching and research and training has started taking place in those levels so that we can generate local data, but because we also have enough faculty to handle that. This, in a nutshell, is how the arrangement of facilities is and how the referral hierarchy is supposed to be in the healthcare space in Kenya.